We will be discussing about renal nutrition. Okay, so kidney and urinary system. So when we talk about renal diets or renal nutrition, okay, so most commonly we come across certain big no's. What are the no's? You should restrict protein, you should restrict salt, water balance should be maintained, low potassium foods or low phosphorus foods. All these things we hear so much. So when we see a case, a clinical case of any renal condition, it could be chronic renal failure or it could be acute renal failure, or in some cases of diabetic nephropathy, and what else, in some cases of kidney stones. So there is a lot of controversy about it. Say for example, some doctors are okay with the protein in case of renal failure, chronic renal failure. Some people are strictly no against this protein intake. So we try to address all these issues in this class. So before going into renal nutrition, let's talk about this kidney and urinary system. So kidneys are bean-shaped structures, right? So they are just below, right side, they are on the posterior abdominal wall, anterior abdominal, posterior abdominal. They are on the posterior abdominal wall behind the peritoneum. So right side usually it is near this liver, right, just below the liver. Left side it is near spleen. Okay, so the topmost structures. And each kidney gives out one ureter which ends up in a urinary blood. Okay, so the function of kidney is to form urine, and the ureters, they collect the urine and carry it into urinary bladder. Urinary bladder stores urine, and from urethra it is excreted out. So if you look at the functions of kidney, the first and foremost function of kidney is to form urine. And by formation of urine, what the kidney is achieving is, it is achieving water homeostasis. So homeostasis is the balance. So water homeostasis is achieved, and second one is acid-base homeostasis is also achieved by formation of urine. And what else? Kidneys also secrete an important hormone called erythropoietin. Erythropoietin is responsible for maturation of RBCs. Okay, and the third one, what else is the function of kidney? Secretion of renin. So we know that kidney secretes renin, which maintains again water balance. Renin, angiotensin and aldosterone system of managing water balance in the body. And what else? It also hydroxylates 25 hydroxycholecalciferol, that is vitamin D. So hydroxylation of vitamin D, that is 25 hydroxy into 125 dihydroxycholecalciferol, that is formation of vitamin D. Now, what happens in a failure, right? If you think about any organ, what happens? What do you mean by failure? If this is the function of the kidney, if kidney is diseased, right? If kidney is diseased, if there is a pathology involved in the kidney, what happens? All the functions are lost. All these functions are lost. So, important function in the formation of urine, apart from water and acid base, another important thing is elimination of waste products, metabolic waste. What are the metabolic waste products that we talk about? We talk about two things. One is urea and creatinine, and finally we have uric acid. And it also eliminates so many drugs that we consume from outside. And not only drugs, it eliminates proton, that means eliminates hydrogen ions. That is the reason why urea is always acidic in nature. urine is always acidic in nature. What is the normal pH of the urine? So we all know that pH scale is from 0 to 14, 7 is neutral, blood is slightly on alkaline side, urine is usually 6. So from 4.5 to 8, in between the pH varies, usually it is around 6. This is the pH of urine. Now, how kidney achieves this function of formation of urine, water and electrolyte balance, acid base, erythropoietin, what are all the different functions? Say for example, in any case, somehow there is a failure, kidney is not able to do its function, that is called failure. Heart failure is what? Heart is not able to do its function, that is called heart failure. Liver is not able to do its function, it's called liver failure. And similarly, kidney is not able to do its function of producing urine and eliminating waste, it is called kidney failure. What will happen in a case of renal failure? So, there is decreased or low production of urine. So, no production of urine is anuria, and decreased production of urine is oligouria. Okay. So, if there is blood in the urine, we call this condition as hematuria. And if there is protein in the urine, we call this as proteinuria. Glucose in the urine, it is called glycosuria. And there are different if there is painful urination, we call it as dysuria, DYS. Dysuria is painful. Okay. And if somebody is not able to hold urine, it is called incontinence. We'll see all of them, but try to understand what happens in a failure. So there is no production of urine and there is no elimination of waste products. So where do they remain? Now if you look at the function, blood is coming to kidney and is going back, filtering out urine. Right? So now this filtration is lost, right? And in urine you have metabolic waste products. Now where are they? They remain in the blood. So the blood levels of all these things will increase, right? So there is increased blood urea. Urea is nothing but nitrogen compound, so we call it as BUN. Blood urea nitrogen will go up, and serum creatinine is also going up. Uric acid in the blood is going up. When acid is going up and acids are not eliminated from that, what happens? It results in acidosis. It results in the blood becoming acidic, leads to metabolic acidosis. What else? There is no production of erythropoietin, that means no RBC, that leads to anemia. Renin-angiotensin system, it is not controlling the water balance, so the fluid builds up inside the body, and vitamin D is not becoming active, it is not converting into active vitamin D. So what happens? This results in impaired calcium metabolism. Impaired calcium metabolism means there is no vitamin D, there is no proper metabolism of calcium, so the bones become weak. So all of them are complications of this renal failure. So before we understand the pathology involved, let's see how a normal kidney functions. Okay, before we know the function of kidney, we should know what the structure of a kidney. And what is the functional unit of kidney? Nephron is the functional unit of a kidney. Now, you take a longitudinal section of the kidney. What do we find? So outermost layer is a fibrous capsule, and we have two distinct areas. So one is cortex, that is just below fibrous capsule we have cortex, right? This is cortex, and below that we can find this pyramidal shaped structures called medulla. Okay, so what are the parts? We have fibrous capsule, outermost layer just below the capsule is cortex, and this particular part, innermost layer is called medulla. Okay, and this is called renal pelvis. So this is medulla and this is called pelvis, renal pelvis. Okay, so the urine is collected here and is going out in different small tubes. They collect and they form a ureter. This is ureter that is coming out. Okay, so these are calyx, renal calyx. They form renal pelvis and finally enter into ureter and collect urine in urinary bladder. This is the cross section. So basically capsule, cortex and medulla. See, these are, so each kidney is made up of close to 1.5 to 2 million functional units called nephrons. Now to filter it, okay, so the blood should come to the kidney by any organ. Blood is coming through what? Artery or vein? It is coming through artery. So there is a renal artery that is coming in, coming in and supplying blood to kidney, and another one that is another blood vessel that is taking blood from the kidney. Okay, that is a renal vein. So blood is coming through a renal artery, okay, and is collected by a renal vein. So blood is coming and going. So in other words, this is an artery. From here it is coming and supplying the kidney, and from there it is collected through a vein and is going out through renal vein. Okay, this is renal vein, this is renal artery. Right? So any kind of organ in our body, whether it is heart, lungs, kidney, brain, artery is supplying to the particular organ, where it gets divided into smaller arteries and smaller arterioles and finally into small capillaries, is it not? And these capillaries form and end up in a bigger vessel that is called a vein. Now, if this is the flow, before supplying the kidney, it should do one more thing, that is filtration. So this filtration happens here, right? So here first it undergoes filtration and then it supplies the whole kidney tissue. So the blood, if it is coming to any organ, why is this coming? It is coming with nutrients, that is carbohydrate, protein and fats, as well as oxygen. So the kidney is made up of functional units called nephron. Apart from nephron, there are different kinds of tissue. There is connective tissue, there is juxtaglomeralar apparatus, there are different kinds of cells in this tissue. So this is also supplying nutrients and oxygen, but also since this is coming to this organ, this is like filtration. First the blood is filtered, then it is supplying all the cells in the kidney and going out. So while coming, it is bringing with nutrients and oxygen, and now it is depleted. And before that, it has come with so many impurities. Those are also collected, and urine is coming out as a byproduct. Let's say this is urine. Okay, so this is where our nephrons are located. So this is like a functional flow chart. It is not like this, but you need to understand when blood is coming in, it is coming for filtration and also for nourishment of kidney tissue. Now let's look at the structure of a nephron. So we all know in our school days itself that there is something known as Bowman's capsule. This is the Bowman's capsule, and then you have proximal convoluted tubule, and this ends up in loop of Henle and goes up again. It is convoluted tube and finally ends up in a collecting duct, right? So this is Bowman's capsule. Let's name them. This is Bowman's capsule, right? And this is what? Proximal convoluted tubule. This is called loop of Henle, a sharp hairpin like structure, and this goes into, this is what? Distal convoluted tubule and finally ending up in collecting duct, right? So now we have if you remember the structure of kidney, right? So we have these things in medulla. These things, medulla. So they are made up of basically the collecting ducts. The loop of Henle. The loop of Henle usually ends here, and finally it is being collected. So the Bowman's capsule usually is here. That is in cortex. Here you see, this is the cortex, right? So here you see Bowman's capsule, and they end up in this loop of Henle, and from here the collecting ducts from different Bowman's capsule, they come and collect, and here the urine is formed. Okay. Now, what is the function of this Bowman's capsule? It is to filter the blood. So for that to happen, an artery must come. Okay, let's say this is the big artery. From there a small branch is coming here, right, supplying this nephron. So an arteriole that is coming into the Bowman's capsule, right, this is called afferent. Afferent is what? Incoming. Efferent is outward. So this is afferent arteriole. This is bringing in blood, and here it forms into bunch of capillaries, and once this is done, it goes out. It goes out. Okay. So when it is going out, this is what? It is still an artery. Remember, it is still an artery. So this is efferent arteriole. It is going out. Efference is going out. Afference is coming in. So this is bringing in blood. But if you look at the structural difference between afferent and efferent arteriole is large in diameter. If you take the cross section, this is large in diameter. Efferent arteriole, you take the cross section, this is smaller in diameter. Okay. So larger blood is coming in, while going up it is cramped up for space. So what are we creating here? Net, we are creating increased hydrostatic pressure. That means we are creating a pressure gradient. So what happens from here? The fluid will come into this space. All the blood, when it is going into the Bowman's capsule, because of the pressure difference, the fluid is coming out and it is collected. This is called filtrate. This is called filtrate. You need to understand one thing, that what is cardiac output? Cardiac output is stroke volume into heart rate, the amount of blood pumped by heart in 1 minute. So that is close to 5.5 liters. Out of that 20% is consumed by exclusively this kidney. That means 20% of cardiac output is coming in. So the rate at which the filtrate is formed, is called glomerular filtration rate, GFR. So 125 ml per minute. Okay, 125 ml per minute. Yeah. Right. So this glomerular filtrate is called, the rate at which filtrate is formed in Bowman's capsule is called glomerular filtration rate. So both the kidneys, they filter about 180 liters of blood per day. Right? So the blood is coming from here, it is entering into the Bowman's capsule. How much? 180 liters of blood is filtered every day by these kidneys with these small structures called nephrons. Out of this, almost 99% is going back into the blood again. So what is the amount of urine formed in a day? Usually it is 1000 ml to 1500 ml. Right? So hardly 1% is excreted out as urine. Rest of it is still coming back to the blood. Okay? So this is the versatility of our nephrons. Nephrons, they really work hard and they filter out all the constituents from the blood into the filtrate, and again whatever is necessary is going out. So what is coming into this filtrate? What are the substances that come into the filtrate? So if you look up blood contains what? Plasma plus cells, is it not? So you take away white blood cells and red blood cells and platelets, whatever is left is called plasma. Okay, so all the cells, they remain in the blood, in the efferent arteriole. All the cells are retained and some large proteins. Rest of the things, they come out into the filtrate. So what are all the things that we have? We have water, electrolytes, nutrients like glucose, small proteins. So all these things, they are filtered out. Out of this, again water is required, glucose is required, so they are again absorbed. So formation of urine now involves 3 steps. Formation of urine involves 3 steps. The first one is filtration, which we discussed here, and second one is, since it needs to be maintained in the system, so these arteries, they extend. These arteries, they extend and they supply the proximal convoluted tubule and distal convoluted tubule also. So into these capillaries, it is absorbed back. It is called reabsorption. And certain drugs, say for example penicillin or aspirin or certain things which are reabsorbed, what happens is they are again secreted back. They are again secreted back into the this nephron. Right? So what are the things? Filtration, reabsorption and secretion. These 3 stages are involved. So blood is coming in, filtered, and again it is absorbed back by the proximal convoluted tubule and distal convoluted tubule, and some of the harmful substances which are not required in the blood, they secreted back into the nephron.